Hi, my name is Lindsay. I am a breast cancer survivor, hence the pink. Um, anyway, my journey has been one that has lasted longer than I expected. When I first got diagnosed, I anticipated it would take about a year of my life to go through treatments, have surgery, um, and heal from that. And but that's not what wound up happening. I had a very complicated case, and things did not go as planned. So there's a lot to my story. If things don't go as you expected or as you anticipate, I think you're probably in the majority. Um, so where would you like me to start?
All right. So I just wanted to know what stage when you were diagnosed with cancer.
What stage it was?
Yes.
Okay. Well, I was 39 years old, so I hadn't yet ever had a mammogram. When it was diagnosed, I think it was considered stage 3, maybe 3B. I can't remember. But basically, I had a very aggressive tumor that was about 8 centimeters large, um, which caused a bump, which I felt. And at the time when I felt it, it was tender and sore. I went to my nurse practitioner who I had been seeing, and she said, "Don't worry about it. It's nothing serious." Um, and that it was a hormonal cyst and that it would go away, with my cycle. Few months later, I noticed another bump that was in a different area, much smaller and not tender. So basically, when I felt the second bump, soon after that, I got the mammogram. And basically what it was a big tumor that had two parts to it that were, reaching the skin so that I could feel those two parts. And so on day one of being diagnosed, it was kind of a crazy day. It was the same day that some fires broke out in California. And anyway, long story short, they had to transport a bunch of patients from another hospital to our hospital where I was at my appointment getting diagnosed. So anyway, later that day I met with a doctor, and that's when they told me that it was this aggressive cancer and that they would want to start me on chemotherapy to see if they could reduce the size, but that, with the plan of either a single mastectomy or a double mastectomy. Um, so about a month later, I started chemo. I was on chemo for about 5 months. I was supposed to be on it for 6, but we had to stop early because I was developing peripheral neuropathy, which could be a long-term condition or side effect if I kept going with the chemo. And they said too that the chemo wasn't really reducing the size that much. So, I was going to have to go through with surgery and probably radiation. Um, is there any question at this point that you have, or should I just keep going? Yeah. Okay.
Yeah. I have
So,
a question. Sorry.
okay.
So just wanted to know like how was your emotional well-being when you came to know that you were diagnosed with cancer?
Yeah, it's a good question. Obviously, I was in a state of shock. And I also, at the time when they diagnosed my breast cancer, I had a cold and I didn't know it, but I actually had walking pneumonia and just I didn't know. So they also found from the pneumonia, they found stuff on my lungs. And so they thought it had spread. And that if that was the case, it would have been extremely serious. For 2 weeks, I didn't know if it had spread because I had to make an appointment to get a lung biopsy so they could look at my lungs and see if it spread. Well, luckily 2 weeks later when I went back, it wasn't lung cancer. It had cleared up from the pneumonia. But I mean, those 2 weeks were just filled with like a mixture of shock, despair, um, panic attacks, anxiety. I mean, we didn't know what we were going to do, if we were just going to try to, go on a cruise and liquidate all our assets. Because I had no idea what it was. So those 2 weeks were really scary. And then, I've been sort of with my illness for 4 years. So I've gone through different stages of emotions. So, for example, in the beginning, I wasn't angry. I didn't have any anger. But as it continued on, around the time I started radiation, I started to really get angry. So do you have another question or should I continue with
Yeah,
this?
we can continue. We can continue.
Okay. So, so I got diagnosed. I actually went back to work, like 2 days later. And, I told everyone at work, and it was very difficult because I work as a psychotherapist and I was working in a hospital setting, in a mental health setting. Um, and so I, started chemo. I, lost my hair a few weeks, after starting. And I was going to work. I also, at the time, my son was 4 years old, or he had just turned 4. I also have, well, right now she's 16, but at the time, a stepdaughter turning 12. So of course, we met with the social worker, the breast care coordinator, social worker, to just talk about kind of, what the journey would be, and, talk about kind of the kids and what they might experience in relation to my cancer. I just kind of returned to life as it was. I went back to work. I worked through most of my chemo. It was really, really challenging. Probably the hardest thing I've ever done in my life.
Mhm.
And it got harder. It definitely got harder after the treatments. I had a mastectomy. The implant I tried to put in got infected and had to be taken out. After that, I started radiation, which I didn't think I was going to do, but they said that if I didn't do it, I had a really high chance of getting cancer again. So I did the radiation, and then for 9 months after that, I wore a prosthesis because I couldn't have what's called a deep flap surgery, a DIEP. I couldn't have that I had to heal for 9 months before having that type of surgery, which isn't an implant. It's having your own tissue transferred up to make a breast.
Mhm.
All of that, the deep flap, which is becoming more common now for women who don't want to go the implant route, I wound up having a lot of complications with it. So let's see. Do you want me to continue on from like after the deep flap, or
Yeah,
do you want
you
me to talk?
can. You can continue on your story. That's fine.
Okay. So yeah, I finally, decided that I was going to do the deep flap because getting expanders, it wasn't going to work. I had a very high chance of having that fail. So
Mhm.
I went this other route to get the deep flap. And that was a really big surgery. It was like a 10-hour surgery, a week in the ICU. A lot of women are very happy with their results, and a lot of women who have had implants decide to do this type of surgery.
Mhm.
I just didn't do a lot of research on it, and I also didn't really have a good surgeon for the operation. Well, I did in the beginning, but then he wound up leaving the insurance I was on. So I had a different surgeon than who I was used to. So anyway, had that surgery, which was a really big recovery because they take tissue from your abdomen, so you're opened up. So that was a really, really hard recovery. And I remember going back to work after that and just feeling like every day was a struggle. I had decided to stop taking tamoxifen because my cancer is hormone positive. So, and I hadn't yet gone through menopause. So I started taking tamoxifen to keep the estrogen levels low, but I had every horrible side effect that tamoxifen has. And emotionally, it was just very depressing. It increased, my pain levels. It just felt like I was sick every day, and I was, trying to go to work, and I was coming home and trying to do laundry and get my kid in the shower, take a bath, and it was just so hard. Um,
Mhm.
I also remember just like I never got to take time off of work because I always had to use my time to do a surgery. So after the deep, I had to do 2 more surgeries to move fat up to my upper chest wall because I had to essentially build up, a breast. Um, so the whole process was just going through 7 surgeries in 4 years was so hard. Um, and my body now, I definitely have like chronic issues. I struggle with fatigue on a daily basis. I struggle with pain, whether, and some days it's really bad and some days it's manageable. And I think I just try to take each day as it comes. And if I have a really bad day, I try to remember that, maybe I'll have a good day, coming. And I try to do little things like, luckily, my dog, he came into my life, about 2 years ago. And it happened, right after the pandemic. So, right before the pandemic, just to give you a kind of like frame of where I was waiting to get my second fat grafting surgery. So I was on the surgery schedule. And we decided to plan a trip because I was, wanted to celebrate my life after cancer, and I wanted to do something. I hadn't gone anywhere in years. So we were planning a vacation. And then right around that time, March 2nd of 2019, so right weeks before the pandemic hit, my father had a stroke and passed away. And then the pandemic came, and I remember one of the hardest things about my journey is that I kind of kept waiting to be in a better place to spend more time with him and to I guess feel like I was ready to live life again. Like I felt like I needed that body part to be complete. And I think that was the hardest thing, was like realizing that, it's like trying to wait for something to be better before you spend more time with the people you love or tell them how you feel about them. That was probably my biggest regret. So, and what I realized in the end is it's not this body part being complete that makes me whole. I have to figure out how to be a whole person regardless of how tortured my body is or how bad I feel I look in the mirror or how many scars I have, and I've got a lot of scars, but that's not who I am, and I have to remember that, I fought really, really hard. And I feel good that I was told by my breast care coordinator, she said, Lindsay, I have never seen anybody with your situation continue working the way that you were working, going through all that. Not to say that sometimes it might not have been a little unhealthy, but I just feel like, it really tested me. It tested my spirituality. It tested my faith. It tested my belief in God. And, I feel like I lost everything, but I feel like in so many ways through this journey, I've also gained a lot. So that's kind of my story. And today I wound up making a big change in my life. Not today, but in the fall I moved. So I moved to a different state and I love it. And I forgot the story about my dog. I was going to tell that story, but anyway, he's my little healer. and he came into my life 2 years ago on Easter after my dad had passed away. So, and he came from my cousin. She rescued him, and he's been like my soulmate ever since. So there have been some really amazing miracles, and my little son, he was just incredible throughout everything. I mean, he really helped me fight and also make the hard decisions and go through all the pain. It was, you know, so that I could keep, keep being a mommy to him. And he's just the light of my life. And yeah, and today, or, 2 weeks ago, I started acting classes. So I'm doing some things. I'm also working on a blog and a book. I still work as a psychotherapist. So, even though there's been a lot of difficult things that have happened, including the pandemic and illness and whatever, there's still hope, and there's still light, and there's still the rest of the journey. This is only just, the beginning. So I'm excited to see what happens next.
Oh, nice. So, just a few questions, Lindsay. So, did you try any alternative therapies during your treatment, like naturopathy, Ayurvedic treatment, anything like that?
What's that?
Did you opt for any alternative therapies during your treatment,
Did
like
I opt out?
naturopathy? Yeah, any naturopathy, Ayurvedic treatment. Did you think of doing anything like that?
Like saying no to treatment?
Yeah, no, to the basic treatment, conventional treatment like chemo, radio. So, did you opt for anything like any other treatments?
No, I mean, I didn't. I'll say this, I did not want to do the radiation. I was not happy. I had a friend who went through breast cancer, and she opted out of radiation, but the doctor wound up talking me into it because it just was really necessary. So I did the radiation. I not happily. I was upset about it. The tamoxifen, which was the hormonal pill, that after 3 months of trying to adjust to the side effects, which I didn't, I stopped taking the hormonal treatment. So, but other things I used, no, I didn't use a different treatment or anything like that.
Okay. And so one last question will be like, if you have to sum up your whole journey in one sentence, what would that be?
Well, okay, so one night I got off work and I was so tired, and I was trying to put my son to bed, and I was just trying to muster up all the strength I could. And with his little small hands, he's 4 years old, he starts doing sign language, and he starts singing, "Blackbird singing in the dead of night. Take these broken wings and learn to fly." So I'm sure a lot of you know that song. I can't remember who sings it now. But that song for me, and those lyrics, take these broken wings and learn to fly. That's sort of my journey.
All right. Thank you so much, Lindsay. It was really inspiring, and you have narrated the story really well. So thank you so much once again. I'm pretty sure that this will inspire and motivate people who are out there, like caregivers and survivors. So thank you so much.
You're welcome. All right. Thank you.